Let's go in and look at a patient encounter. We'll simply click on Sally Smith, and we see the patient demographic page. The top tabs are Summary, which this is the summary page, History, which is any history record of the patient. The Encounter page is where we will start our work. We'll click today. We'll go and review a couple of H&Ps and EVLTs that we did earlier. But simply by clicking into the H&P, we can see what the MA had collected. Patients here for, patient complains of swelling, tenderness, and so on. These things are taken from a quick pick drop-down list of shortcuts. New varicose vein patient. And it's as simple as that. The height and weight calculate the BMI, so let's go ahead and we'll change this number to 68 inches. And if we come down here in the BMI and click it, it changes her BMI, body mass index. Chief complaint, pain, swelling, varicose veins. We can click restless leg syndrome, and we can keep scrolling through here. Previous treatments include, let's go ahead and add maybe some compression hose. And all by just drop downs and clicks is how we're doing this. Worse with, walking, working, end of day, and we'll add menstrual cycle. Improved by elevation, rest, beginning of day, Tylenol, and compression hose. There's your social history. You can change that to rare, and so on. So you can see how these notes are very easy to create. You can add whatever. Again, here, hypertension, will also add high lipid level, hyperlipidemia, allergies, no known drug allergies, family history, father had hypertension. We might want to put in here a comma and put in something else, high cholesterol, current medications, might want to add something else. Again, these are for matters of demonstration purposes to see how these pages interact with the chart notes. This is a brief review of systems. If you check a box, it is abnormal. However, we do have a full review of systems here. You can grab constitution, you can grab musculoskeletal, and so on. So it's in the pick list and it's here. I'm just going to go ahead and mark all normals except for lower extremities. This is where the MA gathers the pulse rate and the BP right there. And this is where the doctor or the provider would put in the SEEP class. So if I go ahead, these are auto-calculated right there. You have your arterial pulse checks right here. Other exam is if a patient is not in for venous insufficiency, they're having knee pain, and you decide that it's more of an arthritic condition, you can note that, and it would then create the referring physician note. Down below here, the risk factors. I'm just going to take family history off of there, and that'll change up our note a little bit. Here's our drawing tool. This is for patient education. It's a Java applet. It allows you to actually draw on the computer screen and explain to the patient exactly what the condition entails and how they got here briefly. Here comes my drawing tool. I'm going to pick my color here, and I'll pick my drawing tool, and we'll explain to the patient, dear patient, in a normal leg the blood goes up and these valves keep it from coming back down. And the blood gets pumped up. In a varicose vein, venous insufficiency, the blood goes up, comes right back down, and creating bulging veins right in here. We're going to help alleviate that. Difference between veins and arteries. By the way, we're going to click on the drawings to help the pre-certification process. We're going to mark for these legs what we're going to do and what we found. So we're going to tell the insurance company we're going to ablate this, and maybe we found some ropey veins here. Ropey veins. I'm just drawing using a mouse. Quite easy to do. You may want to make a note there. And Control D saves it. And there we go. You might want to note a perforator in a different color. In this case, we'll choose green. We'll pick a different drawing tool. We'll mark above the ankle. And now we'll also put in a quick text to note the perforator. Excuse my spelling. Let's do perf. Control D saves that, and now you have a marked chart. If you do need to revert, you can revert this and it'll clean it off for you. Again, matters of demonstration purposes, we're just going and reviewing this H&P. Down here earlier I had checked off all normals, and it brought up for my exam all the normals, except my extremity studies, which by the way were pulled out of my SEEP class automatically by pressing populate data. Going on down, I pulled the vein mapping study that we did into the lab data, and I have an assessment which again is in the drop down right here, and we can add to that. And also here, some choices as far as custom text goes here, pre-cert EVLT, and so on. This is my plans and orders. What this does is, as I pick what I want to send to the front desk as a request for the next office visit, or supplies, putting the patient into compression hose perhaps, these things then get pushed into the patient's face sheet. We bill our encounters as so. Click the ICD-9. Here's your most common. We do some database tricks that allows the most common to pick up through here. So to simply code the event, you simply click and they get posted into the right side here for billing. Once you're done your billing, and I'll take a look at CPT search, most common, I'll do a flyover, and it tells you exactly what you need to do to achieve that level of coding. Once you're done, you simply hit send the billing, and it goes to the billing department screen so they can get the claims out. Let's go ahead and we'll go into the summary so I can show the demonstration of the plans and orders right here. Here's the orders that I pushed. I want to do an EVLT of the right great saphenous vein next available. By the way, put the patient in compression hose. From here, the front desk person can simply click on New Appointment, select an appointment date, and type EVLT, and pick a date, next available, say Thursday, and hit save. And now she has an appointment set for Thursday. Going to the encounter screen, we'll review brief documentation right here, and we'll take a look at this office note. Here's the office note as it was created, coming up in Word. Now this can be faxed right off of your desktop. Review systems. This is what I set up for demonstration purposes. These are completely customizable to fit your needs. Let's take a look at also the an EVLT that we did. Oops. Note laser right here. So there's everything that came out of my opera report. And again, fully customizable. This concludes the Encounter section.